Welcome to the Point of Medicine podcast, brought to you by LearnNeuralTherapy.com. Doctors Ann Hill and Ilana Gurevich team up to take a deep dive into the art and science of healing. This podcast explores cutting-edge approaches to the autonomic nervous system and its role in organizing fascia for optimal health. Each episode features conversations with leading clinicians who are pushing the boundaries of medicine, uncovering new insights, and transforming patient care. Join us as we bridge tradition and innovation to expand what's possible in modern healing. This podcast is for informational and educational purposes only and not intended as medical advice. Please consult your healthcare provider before making any changes to your medical plan.
Hey everybody, welcome back to the Point of Medicine podcast, where we interview leading providers in the field of injection therapies and also functional medicine therapies, as well as naturopathic therapy. So we're excited today to be interviewing Dr. Sharon Krahn. She is a nurse practitioner and family nurse practitioner, and also a traditional naturopath. And she practices, you're out of Dallas, Texas, or right outside of Dallas?
So I'm in Dallas.
In Dallas. Okay, great. And you have over 20 years of experience doing a lot of like holistic medicine, which is great. And then you have studied with lots of different people. And you were just telling us before we started here that you were a traditional naturopath, but you wanted to learn more. So that's why you became a family nurse practitioner, which is amazing. So you could just really do a lot more for your patients. And then you treat patients who have both acute and chronic illness. So let's go ahead and just start. Tell us what do you do? And how did you get there? How did you find the windy road to getting to what you're doing?
Thank you for having me on, first of all. I'm honored to be here. But yeah, it is a long and windy road that brings, I think, any of us here. And I think like most people in this field, it's part my personal journey, but I started with having miscarriages. I'd had 3 children pretty easily, not really thinking about it. And I think like a lot of young women, I didn't realize how unhealthy I was, and I was tired and just, this is what it feels like to be a mom, and you're just tired. And then all of a sudden I had a surprise pregnancy and got real mad at my husband, and then came around, it's like, okay, this is going to be okay. And I always said I wanted a big family. So here we go. And then at right about 12 weeks, I lost the baby. And then we were, of course, devastated. And then I went, all right, yeah, I think I do want this number 4, and gave myself a little time. And we tried again, and I lost it. And again, and I thought, what is wrong? This isn't right. I never had trouble getting pregnant, carrying a pregnancy. And I went to my doctor, and they offered me Zoloft because I was crying. And that's the only time in my life I've ever thrown something at a healthcare provider. And it's interesting because I didn't know anything about anything. I was probably the least crunchy person you would have ever hoped to meet. My mom, however, was very, very crunchy. Like, I was embarrassed to go places with her because she smelled like essential oils. And this was in the 80s when nobody smelled like essential oil. And we're in Texas, right? I know y'all are in Oregon, but nobody in Texas smelled like oils.
Uh-huh.
And I just realized, there's something going on. And so that kind of led me to, throwing pills at the doctor. They did finally do tests and went, oh, you have autoimmune problems. And so I sat on it for a while, and I took it to my family doctor, and he said, Sharon, if you were my wife, I would tell you to look outside the box on this. And that's what prompted me to finally talked to my mom about it, and she got me in with her naturopath. And then I started down this whole road and realized how much diet and lifestyle played into it. And then I experienced NAET actually, because I had developed really severe allergies, and I went, oh my gosh, I want to do this when I grow up. So I enrolled at Clayton College of Natural Health, which does not even exist anymore.
Wow. So very traditional.
Yeah, I learned it's a study, that traditional naturopath, it was water therapies and homeopathics and iridology and massage and acupressure and just all the traditional folk remedies and classic naturopathic studies. But there was no medicine, no surgery, no pharmacology, nothing like that. But it was a lot to it was a lot to help me and it was a lot to help other people. And so I started a part-time practice off of that. But the more I saw people, the more I realized there's a real gap in my knowledge and I wanted to do so much more. And it's one of those things, the more you do, the more you realize you don't know. And I came into contact with whole body thermography. I love this. I want to do it. And then I met Dr. Ottmeyer and he introduced me to neural therapy, and he did it on my daughter who was with me. We'd gone to Switzerland and we were in his clinic, and it just blew me away. And that was a game changer. And I had already gone back to school at that point, and I could not wait to finish my nurse practitioner. And that was like first thing I went to your class to get my neural therapy training in America because I wanted to do it. I just had to.
You're like so new in practice. You were so new with your NP license. I didn't realize that.
Mm-hmm.
Well, and how did you end up at this clinic in Switzerland is what I want to know.
I had a whole body thermography system from America that I had just had so much problem with. And I tracked down the Swiss system and I tracked down the company and I begged and pleaded and he let me come to Switzerland. And I ended up spending several days with him, and he's a lovely man.
Man, you've never.
And Mr. Item, and I went and stayed with him, and he took me around, and he brought in other doctors. I got like my own little tutelage, and Ralph Ottmeyer was I got to go see his clinic and spend the day with him, and he was just so welcoming, and he's such a wonderful teacher. And so yeah, that's kind of how. And we were getting trained. I'd taken my daughter with me because she worked with me in my clinic as my thermography tech. And so he was so kind to her as well. But that's how we ended up there.
Okay, that's pretty cool. Wow.
Yeah, lots of little rabbit trails. It's lots of little side steps that have taken me in my journey with my practice, but none of it seems very happenstance, but it's all been very intentional because a lot of it has had very personal roots. But then I think too, there are just people that are put in our path as we go along, and I'm very determined. I may not know what I can do to help you, but I'm going to find somebody else who can help you, or we're going to find a tool that is going to do something for you, because by the time they end up in my office, they've already been everywhere. They've tried all the mainstream things. So it is incumbent on me to be creative and to be thorough, if nothing else. And so I don't like murder mysteries, but I do like a good medical mystery.
And that is, I think, what makes our type of medicine so creative and satisfying, because they've exhausted the algorithmic approach. Like, they're not going to start with me. Nobody starts with me. But by the time they're at me, I have true freedom to think outside the box because they've done the box. It's not working.
Right. Yeah. Yeah. And you know what doesn't work. So you get to skip all of that. Yeah. And usually I find that they're more open to trying new things. And I think at that point too, you're not in such a position where you're having to convince somebody, no, your diet really does matter. They're ready to hear it. And so it does make my job a little bit easier being in that position.
Or no, your fragrance really does matter. That's
Yes.
a hard sell when patients are like, what? I'm not supposed to smell like Febreze Power Packs?
That's not the smell of clean. Yeah.
So Sharon, do you have other practitioners in your clinic, and can you tell us a little bit about what types of patients you're seeing? Are you specializing in fertility since you kind of came out of that, or are you seeing a little bit of sort of everything like we are?
Yeah, I do see a little bit of everything. I have a health coach. I'm a holistic health coach who's in here with me, and it's really just me and her at this point. We will be taking on another provider later this year, but really, we try to take whatever comes through the front door if we can. Mostly, we see a lot of chronic illness. There is a lot of autoimmune, there's a lot of environmental illness. I feel like when I look at what tests do we run, it's probably a lot of toxin tests and genetic tests more than anything else, because everything else has been run. So a lot of mold here in Texas. We do deal a lot with that. In fact, my name, K6 Wellness Center, part of it when I ended up naming, I used to do a lot of lunch and learns like for attorney groups and stuff. And so I had to come up with some, catchy something, something. So it was like 6 keys to natural health. I was like, K6, we're the Krahns, there are 6 of us. And so it just worked, right? And I'm also not very creative. And so that worked for the name. But where was I going with that? Also, when my husband's company sold and I was like, take a year off. His parents needed some attention. And then I was like, okay, we are a family business. So you're one of the K6. I need a mold inspector that understands health. So he went and got his mold inspector's license with his
Wow. That's great. I didn't realize that. Okay.
Yeah, just because I needed somebody who could answer questions. And he's just recently, I was like, you need a break because he got into too many. I don't care who you are or what kind of Superman you are. And I had him, like, he would come in and do ozone after every inspection. And we were doing, sinus injections and stuff, but it wears on you. And so I was like, you need to take a break. But he's really good for helping me with information and just increasing my knowledge base because he knows so much about the different molds and he's a good researcher.
So when you're doing toxic testing, you're using what, the Vibrant America panel?
Yeah, we do a lot of the total tox burden test.
I just learned about that. I just had a patient come in with that test for the first time ever. I just learned.
Really?
Interesting test.
I love that test. And I feel like sometimes, especially with the heavy metals part of that test, I tell people, like I had one yesterday where there was hardly anything coming out. And we have people challenge, for 5 days ahead of time with glutathione and sauna, if at all possible. Sometimes it's what doesn't come out.
Right.
It tells us more than what does come out. So it's really good information.
And so you're having them do 250 milligrams of glutathione twice daily, or how are you provoking?
Yeah, we'll use a liposomal glutathione. I do like the Apex Energetics trisomal. And if they can do it, I'll have them do 10 mLs twice a day for 5 to 7 days. Get in a sauna, sweat for 30 minutes at least, and do anything we can to provoke get it out of their tissues so that when they do their urine collection and make sure that they've concentrated their urine, if we can get a 6-hour, overnight concentration, all the better. But some people can't.
Morning urine when they haven't peed all night after they've done the glutathione and the saunas.
Yes, ideally.
Yep.
Yeah, that is the provoked testing. That's great.
And you're not using any DMSA, DMPS chelators to provoke. You're just doing glutathione to push.
That's all I'm doing. Yeah.
Yeah. Well, one of the things that mold does is it basically uses up all of our glutathione.
Yeah.
So then nothing comes out unless you start giving glutathione. Like a lot of my patients can't even sweat by the time they end up in my office. And I'm like, yeah, there's a lot of stuff in there. We got to take care of that.
Yeah. That's one of the first questions we ask people is, do you sweat?
Yeah.
You sweat? Because there's a big difference between, are you able to sweat if you try to, or do you just not do anything to sweat?
Right. Yeah.
Yeah. And then some people have that smell where you're like, you really don't sweat and you need to.
Yeah. Tell us a little bit about introducing now neural therapy into your practice.
Oh, man, what a game changer. I love neural therapy. My staff teases me. They're like, you will just stick a needle anywhere, won't you? Yes, I will.
You're bitten by the bug.
I have been bit by the bug. Thank you, ladies. I love the neural therapy. I do, especially the pelvic injections. I have to say, this is so big because I get so much with not just infertility, but women with C-section scars, tummy tuck scars, endometriosis, PMS, painful periods. And I had one couple, I was treating both of them. They had separate fertility issues, but they want to conceive. And so I said, let's have you both do the Frankenhausen. And they told me later, so I treated them both on the same day. And they're like, we had the best sex of our life. And I was like, all right, let's go. But the first time I came home after I learned it, I actually was doing it on one of my daughters, and she had just, I have 4 daughters, so I have great practice dummies, right? Not dummies, but practice models. And she had just started her period, and she's the one who doesn't do what mom says, and she walks around perpetually dehydrated. And I said, let me do this injection on you. She said, okay. And she was blown away. She said, I did not have cramps at all. And it made a believer out of her. And I was like, well, you are kind of numb, but it does do more than that.
Yeah. Yeah.
Yeah. So I do love the pelvic injections and just treating scars, what women report just with low back pain. And I think for me, definitely in nursing school, watching C-sections and seeing how brutal and barbaric they are, it's no wonder women complain about low back pain after C-sections and they have chronic problems. And so treating those scars with neurotherapy, I think is just so important. Even if they don't have chronic back pain, I just feel like that is such a big part of removing those interference fields. And so I do love that. And it's kind of fun to watch people release emotions, because I invariably forget. I get so excited about what I'm doing and I'll forget to warn people, you may have an emotional release when I do this, especially the IRR, the infraspinatus respiratory release. Did I call it right?
That's right.
Call it IRR. I feel like that one makes or causes people to maybe release sadness or
Yeah.
which makes sense because with lungs, that's the seat of sadness and grief. But I have had people just cry spontaneously more using that injection. I was sorry, I forgot to warn you. You might cry, and whatever's in your head, it's okay. You may be reliving a sad point in your life. You can talk about it if you want, but you don't have to. But I encourage you to let it out. And invariably there is some sad event or a trauma that comes to their mind immediately that they haven't fully let out. So,
and a lot of times people don't even remember it, which is really amazing to me, that the nervous system, once it starts reconnecting, that it brings these memories back to people. Yeah.
So I feel like, what doctor was it? Lee Cowden, who said, if you want to just feel better, you can take care of the physical body, but you've got to have the emotional and the spiritual healing to be truly healed. And I think really allowing those emotions a way out of the body is so important. And I think neurotherapy is such a really valuable tool to allow that to happen anywhere on the body. So yeah,
I feel like back to those tummy tuck scars. Those tummy tuck scars are so burly. They go across the entire abdomen. They take me so long and they cause so many adhesions.
Yes, I'm doing one right now. It was like an arm tuck.
Wow.
It goes from the elbow all the way down under the breast, so through the armpit. And it's really where the cannulas or the cannula insertion sites.
Yeah.
Boy, but this was the 4th time that I had to go. And we're just down to spots, just the sticky spots. But I added the ozonated glycerin this time instead of just ozone gas. And so I'm really anxious to see, because the whole idea with the glycerin is that it stays in the tissue longer, right where you want, or stays localized, I guess, longer. So I'm really anxious to see what kind of result we get using that.
Is it very viscous?
It is more viscous, but I am diluting it in saline.
Okay.
So I think you do like a 1 to 10 is what I've heard.
So what, like,
you can do a 1 to 10, but you can do a 5% ratio too. It just depends on who you ask. I think I did a 10% on her. I tried a 5% and I said, I put a little bicarb. I had my pH paper because I was like, I don't want to burn her. And I made sure that it was buffered well and she didn't complain. So I took it up to a 10%. And so we'll see. Yeah.
And then one of the things we were talking about off camera is you are also playing around with exosomes.
Yes.
Can you talk us through that? What is it? How are you using it? What are you noticing?
Yeah, I really love the exosomes. Just like the neural therapy is such an amazing tool for so many different issues. The exosomes also are a great tool. I feel like neural therapy can be introduced earlier in a process. Exosomes, I don't want to introduce until I have a person really on the path to, well, having a good foundation laid. Like, are you fixing the diet? Are you on the right supplementation? Are we addressing deficiencies? Or, are you able to detox? Things like that. I'm using exosomes in different ways. I mean, I've done the hair restoration, really interesting results with that.
So you're literally just like lawn mowing exosomes in the scalp. Is that right?
Lawn mowing. That's a great term. Love it.
I know that some places they micro needle it in. I'm actually doing subcutaneous injections.
Just a bunch, like 100.
Yeah, there's about a 1 centimeter spread on it. So I'm just doing little blebs, just like you would with neural therapy. I'm just doing little bitty blebs.
And you're seeing hair growth.
Yes.
And they are, and they're not smacking you in the face out of pain.
Well, okay, so I do a supraorbital nerve block because it's pretty stingy.
Yeah.
It can be a little stingy. You could put numbing cream on, like you could do a BLT and let them sit for a while. I think that's kind of more ideal. And then some distraction, like with a little vibrator thing, just to distract, that helps. But yes, and depending on the strength of the exosomes, the concentration, you can get, different levels of success. But the recommendation is that you would do it maybe once every 6 weeks for 3 or 4 rounds, and then maybe once or twice a year. But it's similar to what you would do with PRP. I mean, with PRP, you're getting your stem cells and exosomes. So maybe we say what exosomes are.
My next question.
So
what are they?
You have stem cells, which are, they're up for grabs. They haven't been claimed by a team. So they could be team hair, they could be team muscle, team heart, team bone. But once they're committed, that's it. They don't get to change teams. Where exosomes are parts, they come from stem cells. So they're little vesicles or envelopes of the regenerative proteins and nucleotides and lipids within a stem cell. So you're not dealing with tissue, you're just dealing with a component of tissue. So it's much smaller and you can put in a lot more, and the signals on an exosome I think don't last as long as the signals on a stem cell, where stem cells will take 12 weeks to fully express. Your signals on an exosome, depending on the exosome, could be days, a couple of days to like 7 days. But you'll continue to get effects beyond that, but the signaling kind of ends sooner.
And then where are they taken from? Where are exosomes from?
Well, you can get exosomes from all kinds, like fat cells, bone marrow, but good ones. The only kind you really want to use are the mesenchymal stem cells, from mesenchymal stem cells, like from placentas and umbilical cords. Well, and this is American exosomes, right?
Are they treated? The exosomes, are they treated before they're injection ready, like radiation or?
Are they radiated?
Yeah, I thought, because they can't be live.
They're metabolically
active.
Yeah. I mean, the thing is, it's not live tissue because it's not tissue, right? It's a component of tissue. So, but it does have it. It's pretty amazing with exosomes, which you can, like the hair. I have a picture, but I don't know how it would show up here. It's on my phone, but you can do hair. I only use placental and umbilical cord blood from day 0. It is an FDA regulated tissue harvesting process. And the labs that do the exosome processing or generation, those are all FDA regulated, right?
Okay.
So I think there are a lot of companies now doing it.
Yeah, we just recently talked to a company. They came in, and what they're doing is they're taking auto harvested. So you harvest like a very small amount of fat cells from a person, and then you send it to the lab, and the lab synthetically regenerates that person's fat cells. And so it's autologous, right? So it's taken from the person, you're injecting the person back into the person, but they regenerate those cells. It's interesting.
What about the survive? I haven't read good stuff about fat cell exosomes. I'm just curious.
I'm not doing it. So we met with a company because my business partner does orthopedics.
Yeah.
So there's a lot of it's out there right now.
I would say, and I always tell people, if you want to know anything about exosomes, because I get so angry when doctors go, there's no research. That is a crock. You go to Google Scholar and you type in exosomes and anything, and there are thousands of papers. And the other day I was injecting a lady. Now I don't know if it was the ozone, if it was the if it was the prolozone, or was it it wasn't the exosomes. But I think there's so many things that we can do with exosomes and neurotherapy that are so regenerative, and people don't want to give any credit to any of it because it's not FDA approved. I just get so over it. I'm sorry.
Yeah.
But anyway, okay. So then the exosomes. So you can do exosomes like in your mouth. You can do exosomes where there's tissue damage. I do intra-articular, like a prolozone injection. You can add PRP at the end of it, right? Like you can do the procaine. Some people add B vitamins. You can do the procaine with the dextrose, in which now some people say instead of the dextrose, add the ozonated glycerin, which I'm starting to play with. Don't have anything to report yet. And then the ozone gas, but then you can add PRP or you could add exosomes. And then the other thing, you can do IVs with it. You can do systemic with exosomes, the mesenchymal.
And that just makes whoever needs it will claim the exosomes on their team.
Yeah. And so I've been, but you know what? It's really interesting. One of my first clients that I did exosomes with, I did intranasal. So I did a lower potency intranasal. These were umbilical cord.
Like, sphenocath, or like to go a little bit deeper in there?
Just a nasal spray. It was a lady who had 3 to 4 migraine days a week, debilitating 10 out of 10 migraine days. She has malaria. And I think she had Lyme, then she got malaria, co-infection, and then she had a whiplash injury. And she's she's had so much neurotherapy. She's done all the things. She's been to Mexico. She's done everything. And I said, look, you have nothing to lose. Let's just try it. You have to do it every day. So every day, 1 spray in each nostril. She quit having migraines day 1. She got like 8 days in and she forgot to do it. And she said that night, I felt a migraine coming on, so I remembered to do it. And she said, I never developed a migraine. She quit having migraines. I mean, that's pretty amazing.
Yep, that is so cool. Like these people have no options. You know what I mean? Like literally they have no option.
And I would not say exosomes cured migraines because obviously the causal features have not been addressed. Now, how to get to that, her whole team is still trying to figure it out. And it's very difficult. Like she's got splenomegaly, but with nuclear imaging, it still shows that her spleen is functioning. It's out of my depth in that regard. That's not my forte. But I do know that the exosomes are really helping to manage the debilitating symptoms. So I'm glad to be able to offer that.
Where did you learn about exosomes?
I guess I've just...
Trick question. Sorry.
Where did I hear about it? Well, I guess I heard about them more in the aesthetic space first. But then I thought, I know what it was. That's why I thought they're just for aesthetics, like for facials and hair. And then somebody came in and said, but have you heard about them being used intravenously for systemic inflammation and autoimmune. And I went, what? And then that got my attention. So then I started looking on Google Scholar, and then I saw it being used for Parkinson's and Alzheimer's and, all these inflammatory things. And I went, well, what's the risk? How am I going to hurt somebody if I do this? And then I realized, okay, when you start looking into it, yes, you can hurt somebody if you're using crap quality, or the wrong kind. And so I found good companies, and there's really no risk. That's the beautiful thing about this. Like, people who've had
Financial. There is a financial
risk. And I think that's a good point, because that's the hard part of this. I have to tell people, I can't guarantee you anything.
Yeah.
I can guarantee I'm not going to hurt you with this, but you could spend, like on the low end for a systemic, you might be spending a couple $1,000s. But then you could spend, like my Big Daddy one, I call it the Big Daddy. It's an acellular stem cell. It's a stem cell, but it's got that outer cell membrane removed off of it. So it's somewhere between, it's a hybrid, like between a stem cell and an exosome. So you get more signaling for a longer period of time, a lot more anti-inflammatory. And I think bang for your buck, it's bigger. It's almost $8,000, but I can't guarantee you anything.
The way I describe what I do is, you've done everything else. It hasn't worked. I am going to throw some more spaghetti against the wall. I have a lot of spaghetti that I can use from.
Gold-plated spaghetti.
I have a lot of pieces of spaghetti, but I can't guarantee you. Also, my tools are generally not toxic. Like, I don't think you're going to cause harm, but I can't guarantee you it's going to work. I don't have large clinical trials. Like, that's not a luxury I have in my profession. I wish I did. What I had was out of the box thinking and a whole lot of pattern differentiation that I'm really good at.
Right.
Yeah. That's a great way to describe it. I love the pattern differentiation.
And for people who are really overwhelmed with inflammation, it is something that you can make a lot of difference for them. I think, though, and again, to the whole idea of, do we have the proper foundation in place first? I don't want to start somebody with exosomes.
Yeah,
or
absolutely.
Doing all the right things otherwise. But then another really interesting exosome technology out there is the natural killer cells, exosomes. And
I'm very curious about that.
These are so interesting. It sounds like a movie. So natural killer cell exosomes are really to address, they come from this line of cells called NK92. And it's a male bloodline that had some sort of lymphoma. You can look it up. I'm not going to do it justice. Anyway, I should look it up. I don't want to tell you lies, but I'm going to tell you lies. I don't want to look it up. I don't want to read to you. But anyway, the natural killer cell exosomes are to address senescent cells or zombie cells, right? Like cells that should die, like cancer cells or viral cells. And maybe those cells aren't replicating anymore, but they're still metabolically active. And so when those cells are metabolically active, maybe they're not causing a problem right now, but over time, when those cells stack up, what happens? Well, they're going to age you faster. They could cause a problem. They're adding to your load, right? So natural killer cell exosomes, we put those on board, and they kind of shine a spotlight on these senescent cells or zombie cells. And so it allows your natural killer cells to do their job better. The thing with natural killer cells, unlike other natural killer cell exosomes, unlike other exosomes, you're not going to feel bad after an exosome treatment. Natural killer cell exosomes, it has to be done carefully. And so for me, when I do it, I'm going to observe. I do it carefully, slowly. I'm still perfecting my system, and I want to observe for a while, because we are stimulating your immune system.
Yeah.
And observe for a while means you want them at the clinic for a multitude of hours, or you want them doing small doses over time and then observing what happens?
Yes. I am still taking it on a case by case, because some people, we're still playing around with, do we microdose? Like, do I give you a third of the dose on day one and then maybe 24 hours later? If you've done okay, then I'm going to give you the rest of it. Or do we just do a slow drip with it? So, because there's no protocol for this.
Yeah.
Right. So it's exciting.
It's amazing because, what I'm oftentimes telling people is that we have spent so much, excuse me, of our time creating things that kill things, right? If we have Lyme, if we have EBV, COVID, tuberculosis, we have so many things that we can kill things with, but we don't have anything really that helps to trigger or stimulate the immune system to work better so that we're not creating a war, I'm oftentimes with my chronic disease patients, I'm like, I really wish I had more immuno things to offer you, but we never have focused our view on that part of medicine. And I feel like we have this one great half that's of course becoming obsolete with all the antibiotic resistance, but we've never worked on this other thing. So that's pretty cool to hear about this.
And I think peptides play a role here too. I mean, when you look at some of the anti-inflammatory peptides, and that is something that I like to kind of, ooch in there a bit depending on the person. And one of them that I know we've kind of been interested in is like thymosin alpha 1 with people who've come down with COVID or flu, and just giving them a 2-dose, series of it here, take it home, take some today, take the rest of it day after tomorrow, and people get over it, their viral infections, a lot faster.
Yeah.
So far.
Yeah, I've heard. Yeah.
Yeah. So what was your favorite peptide training?
I did A4M.
Okay, and that was a useful one. You felt like you could clinically put it into practice after you sat through the training.
Sure.
Yeah. Good answer.
I feel like there's still so much needed. I probably have 4 tabs open all the time where I am looking up information for peptides, because I think, Seeds has good information. And then there's Peptide University that is still building out their stuff. But it's a lot to wade through. And then I'll find, random blogs out there, but they'll cite a source and then I'll go find the source. And it's like, oh yeah, okay.
I call that the research hole.
Yeah, the research hole. Yeah. I go down it often.
Me too.
And I feel like there's still such a chasm that we need better or more consolidated and useful information with peptides. So I'm still probably fairly limited in what I do with it, but I just try to be careful for people who do want to come in and use it, especially if they're on like an SSRI or an SNRI and they want something for their brain. Be real careful, because a lot of times they'll come in and they're like, yeah, I'm taking, CMAX, or I'm taking this or that. It's like, whoa, that actually is acting on one of these neurotransmitter pathways. You can't, people that don't understand, people don't know what they don't know about peptides.
But ChatGPT told them.
Yeah, that can be a problem.
Yes, very problematic. Yeah.
And then I don't know, there's open evidence, the medical ID, I'll use that. I haven't checked them out with peptides yet.
We'll say open evidence. I prefer Perplexity. Open evidence is very conventional.
Yeah.
Very conventional. And I think that they have a lot of value. But if you're looking for outside of the box thinking, open evidence is not what you're going to get.
No, I haven't even tried them with. I like them for, is this rash this or this?
Yeah.
Yeah.
Yeah, always. But exosomes, I think, have so much potential, and I think they're really exciting on so many fronts for neuroinflammatory issues, stroke recovery, Parkinson's, Alzheimer's, migraines, but then also for joints, with injuries and people who don't want to do surgery. Maybe it's an option. Maybe it will be enough. But then again, maybe not.
When she was 1990, she got into a bad car accident and she had to have 42 screws put into her leg because of the car accident. And she was, you know, she's older, she's in her 70s now, and she's having a lot of pain. And she was like, I think I need a knee replacement, but she's also osteoporotic. Nobody wanted to do it. And my dad, who is this kind of like, you know, renegade physician, was like, well, let me try some peptides. And he ended up injecting her with BPC 157. And she did not need, till this day, she has not needed a knee replacement. Her knee pain, like she might get sore, but she like stopped being able to walk.
I love BPC 157. I have some of my EDS clients on it and they love it.
Yeah. So I mean, I think that does it going to work that way for everybody? No, that's the trick. Nothing
Yeah.
is. But it's nice to have that tool in the tool belt. I just feel like what I'm seeing is what I'm lacking is there's no good education. And I would love to put together that education, but I haven't had it myself and I'm not using peptides. You know what I mean? So I'm like, how do I get educated so I can pull on these tools more?
Yeah.
Right.
It's, you know, and that's hard because you're going to spend a few grand in the education and you may or may not come away with what you wanted from it. And it depends on, I think too, from what I've noticed, the instructors, what are their pet peptides? You know, what are their favorites? And sometimes it's helpful and sometimes it's not. We just did a podcast on peptides for weight loss because I get so sick of skinny women coming in and asking for, you know, GLPs and GLP-1s. And I'm like, this is not where I want to go with this. And there are useful peptides. I would love to, I'm with you. I would love to see the education come so much further.
Yeah. We might all have to take a trip down to Mexico.
I agree. So did Dr.
Gonzalez, well, actually it was just posted. So they use a lot of exosomes and peptides in their medicine down there.
Well, she was going to do a retreat. Did the retreat?
Yes, she definitely did the retreat. And I think she has the next one coming up sometime in March.
Yeah, we're going to post it on our newsletter. So, yeah.
I call that a CE vacation.
Totally.
I call that a CE vacation.
I think I need one of those. Yeah, absolutely.
Well, I guess the other question that we like to ask a lot of people is, what inspires you the most about the medicine that you do? And where do you kind of see like neural therapy and the injection therapies and the other things that you're doing? Where do you see that going in the next 10 to 20 to 50 years? Politics aside.
What inspires me about it is just to see lives changed. You know, neural therapy is beautiful in that when from the time that somebody lays on the table to the time they get up and hit the door, they've changed. And there are very few modalities that offer that. And I love that. Whether it's a mental health issue where you have somebody who is going through a real tough time and now all of a sudden they went from a flat affect to appropriate facial expressions and better communication, or their pain has been reduced, or you know something big has shifted to less joint pain or a scar that released, you know, that inspires me. Just being able to affect change in such a short amount of time. Where I see it going in the future, I mean, thanks to work like you lovely ladies putting on this type of podcast and spreading the word, I just see more practitioners getting their hands on it and learning it and doing it. And it's like I tell people all the time, other nurse practitioners who come in for me to treat them, and I always say, it's not rocket science. And even if it was, somebody else did it, so you can do it too, right? And I think, you know, one of the things that I think y'all do a good job, and I'm not tickling your ears by saying this, I really mean it, and I think it's a good reminder to all of us, it's listening to our patients. It's listening to what they're telling us and not hearing what we want to hear, but hearing what it is they need us to hear, and then applying the appropriate treatment to that. And neural therapy is great because it allows us to be creative. Yes, we have these shots, you know, we have the treatments that are outlined in black and white in the notebook that I printed, and we can do, there's freedom to go, I'm going to try this. I'm going to do that. And you can add things, and there's always somebody doing something a little different. And it is such a sharing community. I have not encountered a single person who will not share or is unwilling to teach. And that's pretty amazing, I think.
It is the nature of, if you have left the conventional model and you're not buying into that, like, you are looking for any support because you are like, oh, the emperor has no clothes. Like, and so that is, I think, the keynote of this community is everybody is just passionate about, listen, there's another way. What are you doing? Oh, that's interesting. Let me try that. Oh, this is what I'm doing. Like, it is an amazing profession to be in, because it does not have that, butting heads. Like, there's no ego. There's not as much ego involved. There's obviously ego. We're all human, but.
Right. You're right. You're right. It's, yeah. Everybody's in it to learn something and be better and do better.
And you're making a choice to think outside the box and go outside the box and pave your own way, which means you need support because there are so few of us that are doing it.
Yeah.
For sure.
Yeah.
For sure. So yeah, it's an exciting time to be in this field. And I think the future is very, very bright.
I agree.
Too.
Can people find you?
Yeah.
People can find me in Dallas, Texas, but you can look us up online, K as in kite, but k6wellness.com. And we also have a podcast called K6 Wellness Revolution. I don't know why it's called that, but that's what my producer thought was great. And so that's what it is. And because your health is worth fighting for.
Yeah, absolutely.
And the number 6, right? Not K.
Yes, K and the number 6, wellness.com. And we see people from all over. We work virtually with people, and yeah, we'll see whoever comes through the front door.
Someday that I'm sure they'll figure out virtual injections too.
Can you imagine?
It has been lovely. Thank you so much for joining us. Thank you so much for fighting the good fight and doing what you do in Dallas, where we can use, I'm sure, 1 million more of you, because the population is large and they are getting sicker by the day.
They are.
Yeah.
Thank you, ladies, so much for having me on and for such a great conversation.
Wonderful. Thanks. Until next time, everybody.